This season, Alberta experienced an exceptionally large wave of influenza A, H3N2. Over the course of December, influenza A activity rose steeply and placed significant pressure on emergency departments, congregate care sites, and care providers across the province. But there's some encouraging news. Early indicators suggest that influenza A activity has reached its peak. We are now seeing test positivity rates decline, case counts are beginning to fall, and the number of Albertans admitted to hospital with influenza A is starting to drop. Acute Care Alberta works with acute care providers to monitor daily hospitalizations. Based on their monitoring, we know that hospitalizations for respiratory viruses peaked on December 31st at 995 patients, 700 for influenza, 195 for COVID-19, and 100 patients with RSV. As of today, there are 706 patients in hospital, 513 for influenza, 118 with COVID-19, and 85 for RSV. Influenza is, again, the predominant virus that has been circulating, and influenza seasons always vary every year to a degree. This season, we had an early peak, and it was also predominant strain of influenza A, H3N2. This is typically a strain of influenza that is more severe compared to other strains, and especially for those with chronic conditions, elderly, and the very young. So this is what we've seen in Alberta, and we've seen in other jurisdictions. In the years where influenza A, H3N2 is predominant, those are the years we typically see higher rates of hospitalization as well. The vaccine, so influenza vaccines every year, there's some tweaks to that. The influenza A, H3N2 component is usually the lower effective part of the vaccine every year. This year, there's also a slight change of the virus compared to the vaccine, so it's a different subclade. Having said that, the vaccine has less effectiveness for H3N2, but it is still protective and helps decrease hospitalization rates and severe complications.